Wanna pass your med-surg exam? Then let's get started. Today we'll cover 10 questions on infectious diseases. Question 1. A patient presents with a fever, sore throat, and swollen lymph nodes. Upon examination, the healthcare provider suspects a viral infection transmitted by respiratory droplets. Which of the following infectious diseases is most likely the cause? Tuberculosis, influenza, hepatitis A, syphilis. Pause the video and select your answer. If you chose option B, you are correct. Influenza. Influenza is a viral infection characterized by fever, sore throat, and swollen lymph nodes, commonly spread through respiratory droplets. You can pause the video and go through each incorrect option. Question 2. A patient presents with a bull's eye rash, fever, and fatigue after recently camping in a wooded area. The healthcare provider suspects a tick-borne illness. Which of the following infectious diseases is most likely the cause? Lyme disease, Rocky Mountain spotted fever, dengue fever, malaria. Pause the video and select your answer. If you chose option A, you are correct. Lyme disease. Lyme disease is caused by the bacterium Borrelia burgdorferi, transmitted to humans through the bite of infected black-legged ticks. The characteristic bullseye rash, erythema migrans, is a hallmark symptom along with fever and fatigue. Question 3. A patient presents with a headache, fever, and a rash that starts on the face and spreads downward. The healthcare provider suspects a viral infection that is highly contagious and often occurs in outbreaks. Which of the following infectious diseases is most likely the cause? Measles, varicella chickenpox, rubella, German measles, scarlet fever. Pause the video and select your answer. If you chose option A, you are correct. Measles. Measles, also known as rubeola, is caused by the measles virus and is highly contagious. It typically presents with the three C's: cough, coryza, and conjunctivitis, along with fever and a characteristic rash that starts on the face and spreads downwards. Question 4. A patient presents with fever, headache, muscle aches, and a rash that starts on the wrist and ankles and spreads inward. The healthcare provider suspects a bacterial infection transmitted through contact with infected rodents or their droppings. Which of the following infectious diseases is most likely the cause? Tularemia, leptospirosis, rat bite fever, Hantavirus pulmonary syndrome. Pause the video and select your answer. If you chose option D, you are correct. Hantavirus pulmonary syndrome. Hantavirus pulmonary syndrome is caused by the hantavirus, which is transmitted to humans through contact with infected rodents or their droppings. It presents with a fever, headache, muscle aches, and a rash that typically starts on the wrist and ankles and spreads inwards. Question 5. A patient presents with fever, headache, malaise, and a maculopapular rash that starts on the trunk and spreads to the extremities. Laboratory tests reveal thrombocytopenia and leukopenia. The healthcare provider suspects a viral hemorrhagic fever transmitted by mosquitoes. Which of the following infectious diseases is most likely the cause? Dengue fever, yellow fever, Ebola virus disease, Lassa fever. Pause the video and select your answer. If you chose option C, you are correct. Ebola virus disease. Ebola virus disease is a viral hemorrhagic fever caused by the Ebola virus, transmitted to humans through contact with infected animals or their bodily fluids. It presents with fever, headache, malaise, and a maculopapular rash that may progress to bleeding manifestations. Thrombocytopenia and leukopenia are common laboratory findings. Question 6. A patient presents with fever, chills, headache, and myalgia after returning from a camping trip in a region known for its high population of deer. The healthcare provider suspects a tick-borne illness. Which of the following infectious diseases is most likely the cause? Babesiosis, Lyme disease, anaplasmosis, ehrlichiosis. Pause the video and select your answer. If you chose option A, you are correct. Babesiosis. Babesiosis is a tick-borne illness caused by Babesia parasites, transmitted through the bite of infected ticks, particularly Exiscoporus deer tick. It presents with fever, chills, headache, myalgia, and hemolytic anemia. Question 7. A patient presents with fever, headache, and a skin rash that starts as flat, red spots on the face and spreads to the trunk and the extremities. The healthcare provider suspects a bacterial infection, commonly associated with overcrowded living conditions and poor hygiene. Which of the following infectious diseases is most likely the cause? Mumps, measles, scarlet fever, impetigo. Pause the video and select your answer. If you chose option C, you are correct. Scarlet fever. Scarlet fever is caused by group A Streptococcus bacteria and typically presents with fever, sore throat, and a characteristic rash that starts as flat red spots on the face and spreads to the trunks and extremities. It is often associated with overcrowded living conditions and poor hygiene. Question 8. A patient presents with fever, headache, and muscle aches. Upon examination, the healthcare provider notices a rash that begins as small, red spots on the wrist and ankles and spreads to the palms, soles, and trunk. The patient reports recent contact with a pet cat. Which of the following infectious diseases is most likely the cause? Tularemia, cat scratch disease, Lyme disease, Rocky Mountain spotted fever. Pause the video and select your answer. If you chose option B, you are correct. Cat scratch disease. Cat scratch disease is caused by the bacterium Bartonella henselae, transmitted to humans through scratches or bites from infected cats. It presents with fever, headache, and malaise, along with regional lymphadenopathy, especially near the site of the scratch or bite, and a characteristic papular or pustular rash that begins on the extremities and spreads to the palms, soles, and trunk. Question 9. A patient presents with fever, headache, and muscle aches. Upon examination, the healthcare provider notices a painless ulcer at the site of a recent insect bite. The patient reports camping in rural areas. Which of the following infectious diseases is most likely the cause? Lyme disease, Rocky Mountain spotted fever, West Nile virus infection, tularemia. Pause the video and select your answer. If you chose option D, you are correct. Tularemia. Tularemia is caused by the bacterium Francisella tularensis and can be transmitted through insect bites, particularly deer flies, ticks, and mosquitoes. It presents with fever, headache, muscle aches, and regional lymphadenopathy, along with a painless ulcer at the site of inoculation. Question 10. A patient presents with fever, cough, and difficulty breathing. Chest x ray reveals patchy infiltrates in the lower lobes of the lungs. The patient reports recent travel to an area with poor sanitation and overcrowding. Which of the following infectious diseases is most likely the cause? Tuberculosis, Legionnaire's disease, pneumococcal pneumonia, histoplasmosis. Pause the video and select your answer. If you chose option B, you are correct. Legionnaire's disease. Legionnaire's disease is caused by the bacterium Legionella philophilia and is typically acquired through inhalation and aerosolized water contaminated with the bacteria, often associated with poorly maintained water systems in buildings. It presents with fever, cough, difficulty breathing, and patchy infiltrates on chest x rays. Click that subscribe button and join us next Monday.